Dr. Matthew Gooch here from Shannon Avenue Chiropractic. Today we're talking all things acute disc pain. Now this is something that we see a lot of in the office, and when people have an acute disc, in particular of the lower back, it can be really debilitating, really painful. Some of the things that we're looking for there is obviously lower back pain, and then referring pain right down the bum, legs, feet, toes. Now people can describe that as a sharp pain. Sometimes people will describe that as numbness, tingling, or just a change in sensation down the leg. Often patients will have what we call an antalgic gait or position, so they will actively be leaning away from the side of the bulge when they walk and when they sit and stand. Often the hardest thing for these people and patients is going from a change of direction and position, so they will find it very difficult to go from laying or sitting up to standing with that movement and shift of weight down on the lower back discs. I'm going to demonstrate for you in a second some easy exercise that we recommend as part of your morning and evening routine to help manage these. I'll go through those with you now. So as I mentioned earlier, often with an acute disc bulge, that change of position and direction can be really hard, i.e. going from a laying position or seated position up to standing. I'm going to demonstrate for you now the preferred method of trying to get up out of bed. But the disclaimer here is, if that acute disc bulge is painful enough, any position or anything you try and do here is probably going to be sore, but this is the best possible way to try and go about it. So I'm going to demonstrate as if we were sleeping on our back here. So from this back position, we're going to roll on our side. We're going to flex the knees up here, and ideally, if you can, try and let them just lightly hang off the edge of the bed here. And then from this position, using your upper body, we're going to push up to support ourselves. So we've got that torso up, and then square ourselves off and up from there. So first thing in the morning now for our morning routine with an acute disc, one of the easiest ways to again get that little bit of heat into it is of course having a nice hot shower. So most people are going to have a shower before they go about their day or go to work. So again, really trying to get in there, crank up that hot water, get that hot water across that lower back, and then once those tissues are warmed up, then again we'd recommend some light stretching. Hey guys, I'm going to show you now a exercise, a simple stretch that can be done for an acute disc bulge. It's really simple, doesn't require any fancy equipment. It can be done laying in bed or on the floor, whichever is more comfortable. So with this stretch, bringing both knees up to chest, I like to grab onto both the knees, bring them together, and then pull them up towards the chest shoulder here and hold. The reason why we do this particular exercise is to relieve pressure off the base of the lower back, which is where most commonly people have disc bulges at L5, S1. So for our evening routine, we would often recommend to patients that they try and keep that lower back area that's really acutely sore, some gentle heat up to the area. And the reason we recommend that is because often if we can get a little bit of heat to the area, it will increase circulation. It will also loosen the tissue there a little bit. It will make muscle, tendon, ligament, disc a little bit more flexible, a little bit more pliable, not so stiff, not so spasmed. And we would definitely recommend the use of the Flexease heat patches. These are really great. They're a one-time use disposable tool that we use. Just simply open it up, stick it to the lower back, and it will emit a low level heat for about 12 hours. So that's definitely something that we would recommend. If you're having trouble with sciatica and pain continues to persist,